Hi, I am Dr. Buvaneswari. I am practicing at GBF Fertility Center in hospitals. We have two main centers in Chennai, one at Mogapet, one at Krompet. You can go to our website and see the details. Today, one frustrating, most depressing situation where it is a miscarriage. So, we are going to answer for that. General advice, I would like to give general advice apart from medical advice. And we know that there are a lot of reasons for miscarriage, and many times people don't know what is the reason for it. That is where they get into this depression, anxiety and all psychological problems. And for that we need to follow certain rules. First and foremost is we have to become calm. We have to wait. Once the one abortion happen, we need to relax. At least 3 to 6 months take a time, and then start following whatever I am going to say now. First, go for a proper dieting. If you are obese, go for a proper dieting. If your family, any of them are smoking in front of you, or if you are a smoker, which is also again sometimes it is common nowadays, definitely smoking increases abortion risk. In all the studies they have said that smoking, passive or active smoking, increases the miscarriage rate. So you have to either stop or avoid if they are smoking in front of you, or if in your working place somebody is smoking, then again you need to complain, or you need to avoid the place and use something, mask or something, to prevent that smoking effect. Second one is drinking and alcohol drinking. Again, some people who have this alcohol abuse, people can miscarry, so we have to avoid that. And second one is exercise. Physical activity is very important. Mainly directly obesity itself causes miscarriage. Apart from that, people who don't do any exercise and binge eating, or if they are only sitting and working and not moving around, they have high tendency for blood pressure and also high blood sugar levels. Again, indirectly or directly, these two can affect the pregnancy by stopping the blood supply or causing some developmental abnormalities in the fetus. So you need to focus on exercise, diet, and avoid smoking and alcohol. And next thing is general question from the family, whether the woman has to go for complete rest or not, whether she has to go and take some medicines or not, whether to try or not. These are the common questions they'll have. What I would suggest is they can take rest only when indicated, because the rest completely is not going to prevent miscarriage. So we need to understand what was the reason for that miscarriage. Once we know the diagnosis, then we can definitely advise them to go for rest. Where we say rest is when the woman is conceived through the IVF or ART, when she has a multiple pregnancy, or she has some uterine problem where she has a risk for miscarriage, we'll advise them to go for rest. Rest in the sense, again, it's not bedridden. Always complete bed rest increases the chances for blood clotting. That again is a negative outcome only. So we have to make sure that she ambulates, that is, she walks around inside the room at least, or inside the house, and do some activities and leg muscle exercises to prevent complications. Rest in the sense, no need to travel anywhere, and she cannot go outside so that she will contract some infections. These are the situations we'll be telling rest, that is only accepted amount of rest is enough, and good sleep is required, and position is very important. And next thing people have doubt is, when there is 3 months or 4 months, do we have to travel or not? If they are working, most of the women have doubts about traveling. And traveling, definitely we say, if you are traveling by yourself, you should be very careful when you are pregnant. Suddenly something happens, accident, or you have to use your brake, and some cramps are coming, it is dangerous for you. During the pregnancy you may have giddiness, vomiting, sometimes you won't be able to have a concentration. These situations you should avoid traveling by yourself. If someone is traveling for a few kilometers on a regular basis, also fine, but if you have a risk spotting or cramps, I would suggest you better take rest at home, or you can work from home. So these are general advices. And go for definitely testing. We ought to wait for 6 weeks for any blood test, and immediately don't test it. If you test, then the test will be abnormal only. You ought to give 42 days or 6 weeks for the pregnancy changes to disappear. Once abortion is completed, after 6 weeks you can go and meet a doctor. Just get examined for infections, first vaginal infections, do basic testing like rubella and other infection, torch infections, and go for the higher testing only when it is required. So if you go systematically and plan the pregnancy properly, so before planning, at least 3 months before prenatal, that is what we call it as prenatal period, you need to plan your pregnancy. Then you start taking folic acid, prenatal vitamins, folic acid, vitamin D3, B complex, and those are the medications which will help for the baby's neural development. And we have seen many times babies having neural tubal defects. So for that, to avoid, we need to take folic acid before planning the pregnancy. Once you become pregnant, then also you have to continue these medications up to 3 months as per your doctor's advice. And as early as possible, if you have a delayed cycle, if you have already had a diagnosis, then it is easy. If you don't have a diagnosis, after 3 months, 6 months, you conceive, immediately go to the doctor and make sure that your pregnancy is supported well and monitored well, so that you can have a healthy pregnancy. Thank you.